believe it's part of having the right kind of support, you know, and having the right kind of structure around, psychosocial structure around you, may be what's the kicker there.
Okay, so we'll try it. Does this sound right? Okay. My name is Janet Hess, and I appreciate the invitation to talk today. Dr. White has talked a lot about practice level tools and quality improvement at the program level. And whoops. Okay. No, that's okay. And Dr. Ferris talked about her program at UNC. And so I'm going to step back just a little bit and talk about more of a systematic approach to healthcare transition and what states can do to help programs and support programs at the local level and at the practice level. Okay, so for the next 15 or 20 minutes, what we'll do, I'll talk about Florida's approach to healthcare transition with our state strategic plan. We'll talk about some of the implementation activities, and then I'll talk to you a little bit about some of the clinical care models that we have in Florida. We are very fortunate as a state to have several very strong advocates and leading experts in transition. And we were able to get legislation passed in 2008 that required that a statewide needs assessment be conducted. And out of that were to come some recommendations on how to improve transition in Florida. So this is a copy of the report that was submitted to the governor and Florida legislature in 2009. And actually, I have some copies up at the front table if anybody wants to take a look at it. We had 16 recommendations. I mean, it's a fairly lengthy report, but we had 16 recommendations on how to improve transition in Florida. And that whole process was really guided by a public health approach. Out of our planning process, a couple of models emerged. And I like this model. It's a population model, the public health triangle, where you've got on the broad base the broad population of all youth, which is very consistent with the clinical report that came out in 2011. Every youth needs information and referral to the adult care community. Every youth needs to be prepared. And then as you move up the triangle and the needs get more complex and more significant, you need more enhanced planning. And then at the very top for that 5 to 10% of youth with special health care needs that require comprehensive chronic care coordination and management, you have your clinical centers. And at the bottom, you can see the movement from pediatric to adult health care. And then this model just shows the different levels and the integration of multiple levels of services and agencies, influences, and partners. So you've got at the federal level, MCHB, got transition, all the Healthy People 2020, all the medical associations. You've got your state agencies. We put a lot of emphasis on the community level, which I'll talk a lot about in a minute. So they're at the community level, that's the practice level, where you've got your primary and specialty care practices, hospitals, clinics, and then all of the allied services, education, mental health. And then down at the bottom, you've got your key stakeholders and the most important factor, and that's the youth and family themselves and their circle of support. So in this report that we provided to the legislature, the 16 recommendations really encompass 4 major content areas. So one of the areas focused on services and models of care. One of the major recommendations was to create a centralized healthcare transition initiative for all youth and young adults. And that would be located within our state Title V program, which is called Children's Medical Services. And so this centralized initiative would provide technical assistance and oversight throughout the state. And then this initiative would also identify effective service models and help to organize regional public-private partnerships and coalitions, again, kind of emphasizing that community level where healthcare really takes place. We had some recommendations around health financing. We had recognized a need to create a health insurance guide that outlined all of the options for young people in Florida. We talked about working with insurers to develop policies that would support transition and to advocate for insurance payments that reflect all the time and the resources required for their care. We also have a lot of activity and strategies around education and training, and that's education and training for the youth themselves, for families, for providers, and providing professional CMEs and credit for folks that are working with the youth, and then creating an online toolkit and clearinghouse of information. And then the final area where our recommendations focused on was in advocacy, looking for ways to strengthen healthcare transition in Florida and providing systems and creating mechanisms to provide better oversight. So I know you can't really see any of this, but what this illustrates is how that legislative report kind of translated down into a single-page visual of strategies and objectives around those 4 content areas. So all of our strategies, objectives, the mission are all reflected on this single page. So that's Florida's strategic plan in kind of a quick one-page visual. So out of that was the establishment of FloridaHATS, which is Florida Health and Transition Services. So that was established in 2009. And we're funded by our state Title V program, Children's Medical Services. It's administered at the University of South Florida, which is where I'm located. And so we're really a contract with the state. FloridaHATS is a contracted program with the state. I'm the project director, and David Wood is the medical director. He's out of the University of Florida in Jacksonville. And then we have all of these collaborative partners that I kind of identified in some of those illustrations, both at the state and the local level. And this just kind of gives you an idea of how the organizational structure and the funding trickles down from HRSA down through the Maternal and Child Health Bureau. FloridaHATS is within the state Title V program. Charlotte Curtis is the, at Children's Medical Services, is the interim director. We've got our collaborative partners, the medical associations, the disability agencies, the education agencies. And then at the bottom, you can see where we have various coalitions, regional coalitions. And so one of the first things that we did was to establish a website and to establish a place where we could provide a clearinghouse of information. And then over the last 5 years, what we've done is to really look at ways to implement those overarching goals. So in addition to the website and other social media, we've developed a lot of educational materials, training programs, a health services directory. We've done a lot of outreach and dissemination and advocacy, all around trying to adopt and adapt the materials that are available to the state. Every state has its own policies and resources and pathways to services, so we've really tried to take what's available and to accommodate it and make it useful for Floridians. And so the last activity that I mentioned here is the regional coalitions. Again, knowing that healthcare happens at the local level, we have had 4 coalitions that have been established so far. We've used a public health strategic planning process for them. Our goal is to have a regional coalition in each of the 8 children's medical services regions, so we're halfway there. and we keep all of the information materials updated on the website. Just to kind of put into a context of some of the work that we've done in trying to adapt materials for Florida, this is the algorithm that the clinical report in 2011 outlined. And so the circled area is where you talk about enhanced planning for youth with special health care needs. So a big part of what we do is outlining kind of the service pathways for youth with special health care needs. And so one of the things that we've done is we've kind of replicated that algorithm format and showing at various ages the various pathways to services. At age 12 to 14, you want to be talking about a transition IEP in the school system. At 15 to 17, you need to be talking about voc rehab and starting to talk about employment. Certainly before 18, talking about guardianship and SSI. And so this algorithm provides direct linkages to the agencies and the places where you can submit applications. And so I'm just going to quickly go through some of the other materials that we've developed. I've got samples up here. If, after I'm finished, anybody wants to come and take any, you're welcome to do that. We've got the program brochure. This was the health insurance guide that we created that we're currently in the process of updating. Just some handouts that can go to any practice. This was a postcard developed by one of the coalitions. It's kind of a takeoff on the Ask Me 3 national campaign. This can be given away and distributed at community fairs. It's basically telling youth and families to ask their pediatricians questions about transfer and transition. We've got self-advocacy guides that are for specific age groups, self-management videos, a whole series of briefs that are for providers talking about voc rehab, talking about guardianship, showing them the links and the ways to be able to get the information to their patients. We've got an interactive toolkit that has a list of 8 questions that follow along the 6 core elements. And based on the answers to the questions, we have templates that come up that practices can use. And actually we have, so this would be some of the resources for one medical practice's template. But we have the interactive questions for case managers as well, for youth and caregivers, and for teachers. So that's all online and interactive. We have a services directory where you can go in and I look for by type of service and location, providers in your particular area. And then we have just updated our training so that we now have a new training program that's comprised of 10 modules, about 15 to 20 minutes each, that'll be posted on the FloridaHATS website. It's also going to be available for free CME, where if you go to our site, you'll see by early next week, those will all be posted. These are the different course modules, and they're all progressive, you know, starting with adolescent development and then going through all the other areas. And number 9 is care transfer. Number 10 is conclusion and reviewing that all. And then just real quickly, I wanted to just give a few examples of 5 programs that are in Florida. These are not exhaustive by any means, but they kind of give you, Patience was talking about some of the different models that were available. It gives you an idea of types of models. The JAX-HATS program is a primary care program specifically for transitioning youth and young adults with special health care needs. So it's only open to youth with special health care needs from ages 16 to 26. So that's an example of a primary care practice. And this just kind of shows how the primary care is taken care of in the, as the main service. And then there's education and referrals as part of the practice. At USF, we have a youth and young adult clinic that just integrates transition as part of the regular care for any youth ages 11 to 21. St. Joe's Hospital is a complex care unit clinic for kids with complex conditions from birth to 21, and again, transition is just integrated into the service. At University of Florida, this is a specialty clinic, a combined peds and adult transition clinic where both teams are present, and then the youth has the option of attending one clinic right before transfer, attending that clinic over time, or alternating between the peds and the transition clinic. And then the teams have meetings both before and after the clinics. And then finally, this came out of one of our coalitions. We are piloting a model where transitioning CMS clients are transferred to the local federally qualified health center. So we have a relationship with those health centers, and the social worker, this just quickly, that shows that the social worker at the local FQHC kind of leads the client through the process and the transfer. And then going forward, we'd like to look at replicating that and strengthening our children's hospital programs, much like Maria's, and also looking at ways to strengthen our linkage to the education system. So.